What is hyperhidrosis in cystic fibrosis patients? Imagine sweating more than your body needs to cool down. That's what hyperhidrosis is. In people with cystic fibrosis, this condition can be linked to how their sweat glands work differently because of their genetic makeup. Cystic fibrosis affects a protein called the CFTR protein, which normally helps regulate chloride ions in cells, including those in sweat glands. When this protein doesn't work properly, it causes sweat to become saltier and sometimes produced in larger amounts. This leads to excessive sweating, known as hyperhidrosis, in some cystic fibrosis patients. In cystic fibrosis, the abnormal CFTR protein prevents sweat glands from reabsorbing salt efficiently. As a result, the sweat that is produced contains much higher levels of sodium chloride, making it saltier than normal. While cystic fibrosis is best known for causing thick mucus in the lungs and digestive system, the impact on sweat glands is also significant. The high salt content in sweat is often used as a diagnostic marker for cystic fibrosis because it is so characteristic of the disease. Some people with cystic fibrosis experience palmar hyperhidrosis, which is excessive sweating of the palms. This can sometimes be accompanied by a condition called transient aquagenic palmar hyperwrinkling. This occurs when the skin on the palms wrinkles and swells quickly after water exposure, often with a burning sensation. This happens because the altered sweat composition and gland function in cystic fibrosis affect how the skin reacts to moisture. The increased salt in sweat and the potential for more sweat production can also impact the skin. The salty sweat can irritate the skin and weaken its barrier, leading to discomfort or skin issues. Research shows that the malfunction of the CFTR protein changes the skin's proteins, making the skin more prone to absorbing water and becoming more sensitive. This can cause skin irritation and increase the risk of infections or other skin problems. Understanding these sweat gland changes is important for managing symptoms. For cystic fibrosis patients experiencing excessive sweating, it's helpful to monitor skin health, keep the skin moisturized, and avoid irritation. Healthcare professionals can suggest treatments or strategies to help control hyperhidrosis, such as topical options or other therapies. Remember, hyperhidrosis in cystic fibrosis is a direct result of the genetic defect affecting how sweat glands transport ions, not a separate condition. If you or someone you know has cystic fibrosis and experiences excessive sweating, it's best to consult a healthcare provider. They can evaluate symptoms and recommend personalized care to improve comfort and skin health. Recognizing these sweat gland issues helps in managing the overall health of cystic fibrosis patients and supports their quality of life. Always seek professional advice for tailored treatment options and to address any concerns related to sweat or skin health.